Hello, my name is Naomi and I am a clinical specialist at the CAMHS mental health support team in Nottinghamshire NHS Trust. I'm also currently completing my PhD studies at the University of Warwick under Dr. Helen Foreman and Dr. Hayley Crawford in the Warwick Medical School. I'm currently on the Mental Health and Neuroscience PhD programme. My role when in clinical practice is supporting children and young people who have mental health difficulties and also those who possibly have additional needs as well. What I've found when in practice is that there are different ways that children and young people need to be supported, and this can often be with adaptations to psychological therapies or using a creative approach. I've always thought that there's more to what I do in clinical practice and there's questions that I have, and so I've gone down the route of figuring out these questions and maybe exploring and finding some answers by answering them through research. Research is something where you look and you look again, so you re-look to find maybe the issues, the cause, or maybe even explore some answers as well, and see what other people have written about the same subject or found. Typically what the issues are in terms of the role that I'm in is there are children and young people who may have autism or an intellectual disability known as a learning disability as well in some areas of clinical practice that are not able to access mental health services. This could be because of various things, but typically it may be because their additional need is seen as more of the reason why they're having a mental health difficulty, and so they're signposted to other areas and other specialist services. So I came up with this idea of the AIDE study, which stands for Autism, Intellectual Disability and Clinical Practice. The objectives in this study are to, number one, explore experiences of children and young people, those that are autistic or who have an intellectual disability, in mental health services in England. To investigate, number two, the effectiveness of psychological therapies for these children and young people. And number three, to recommend effective referral and mental health support interventions for children and young people who are autistic or who have an intellectual disability. Autism is known as a cognitive need. It affects social interaction and communication with others. Usually this is quite difficult for children and young people who are autistic. Whereas an intellectual disability can affect the ability to learn and to function in daily life. One to 3% of children and young people who are autistic or who have an intellectual disability are also more likely to have a mental health condition. This is at 4.5 times. And nearly 100,000 children and young people with mental health and disabilities also had contact with mental health services in the year 2021 to 2022. Although there's a high number of autistic children and young people, and those with intellectual disabilities referred to CAMHS for mental health difficulties, they are typically signposted to specialist disability services rather than accepted for psychological therapies. And there's not much research around why this happens in community mental health services for children and young people with additional needs. And the research that is there mainly focuses on the views of parents or carers, or the views of children and young people in inpatient mental health settings. My theory is that there is possibly a lack of confidence, training, and adaptive psychological therapies to allow clinicians to effectively work with autistic children and young people, or those children and young people who have an intellectual disability. There is also the common assumption that poor mental health is a symptom of autism or intellectual disability, and not a mental health difficulty needing an intervention in its own right. However, as we know, autism presents as social difficulties, whereas symptoms of anxiety are low mood, including worry and irritability. Additionally, lack of involvement from autistic children and young people and those who have intellectual disabilities have resulted in unmet needs inappropriate psychological therapies, and a barrier between children and young people, families and mental health services in England. Some of the current processes and pathways in CAMHS are not appropriate for autistic children and young people or those with intellectual disabilities, which can create even more barriers to accessing the service. So I'd like to use this opportunity to answer 2 research questions. What are autistic children and young people or those with an intellectual disability's needs and experiences, using narrative interviews with 25 children and young people with support from their parents or carers, where they can share their stories and views of experiences in mental health services and with mental health difficulties. And I'll look at the key themes and analyse. Secondly, I will research how competent are CAMHS clinicians in assessing their needs during triage and treatment of psychological therapies, by creating a mental health provider survey for at least 100 CAMHS clinicians to complete across England. I'll analyse this and the response as well. I'll bring both the results together and then use this to decide what is important to discuss in focus groups in step 3. The focus groups will be with commissioners and managers in CAMHS, and there will be 6 groups in total. I'll look at all the main areas that are discussed and then re-look at the results from the narrative, children and young people's interviews and the mental health provider survey. All the findings will be shared through tables, pictures and key quotes. I'm hoping to create the opportunity for autistic children and young people and those who have an intellectual disability, along with their families, the platform to share their stories, influence referral and psychological treatment pathways, and recommend training to improve practice in CAMHS. If you have any questions or comments, please email me at naomi.williams.1@warwick.ac.uk. Thank you.